Yergasons Test is a medical examination to assess the integrity of the transverse ligament and the bicipital groove in the shoulder joint. This test is named after American orthopedic surgeon Dr. John B. Yergason. During the test, the patient's arm is positioned with the elbow flexed at 90 degrees and the forearm is pronated. The examiner then resists the patient's attempt to supinate their forearm while the patient simultaneously tries to resist the force. The test is considered positive if the patient experiences pain or when the bicipital tendon pops out of the bicipital groove. Yergasons test is commonly used to evaluate patients with shoulder pain, especially those with suspected biceps tendinitis or bicipital instability. It is one of the several tests used to evaluate the shoulder joint and its surrounding structures, and the test results can help guide the course of treatment for the patient. Yergasons test should be used when evaluating patients with shoulder pain, tenderness, weakness, or clicking sounds. These symptoms may indicate a range of shoulder conditions including biceps tendinitis or bicipital instability. The Yergasons test is a valuable source for a wide range of medical professionals such as orthopedic surgeons, physical therapists, sports medicine specialists, healthcare providers, medical students, and residents. To use our free Yergasons test, follow these steps. Download our Yergasons test from the Carepatron platform, which you can find in the link in the description. Ask the patient to sit or stand with their arm at their side, elbow flexed at a 90-degree angle and forearm pronated. Stand in front of the patient and place one hand on the wrist and the other on the elbow to stabilize the arm. Next, instruct the patient to attempt to supinate their forearm against the resistance provided by you. Next, simultaneously apply resistance to the patient's supination motion by pressing down on their wrist. Assess the patient's response for any pain, discomfort, or clicking sound, and also look for any bicipital tendon movement out of the bicipital groove. Note the patient's response and document the results in the patient's medical record. A negative test result indicates that the biceps tendon is likely intact and in its proper position within the bicipital groove, while a positive test result may indicate a problem with the biceps tendon, such as biceps tendinitis or a bicipital instability. Here is a sample of our Yergasons test, which you can find on our Carepatron platform. To find our Yergasons test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.